Okay, and we should be good to go. And I started recording as well.
Okay, great. Should I wait for it to populate? I'm not really seeing a change yet.
We don't have any actual attendees that aren't part of like the staff or the board. So
Okay, all right, so I can proceed. Okay. Good morning, everyone. We're going to open this Board of Health meeting for October 9th. Per the governor's emergency order suspending certain provisions of the open meeting law, we're meeting via Zoom. All the members, I'll go through your name, and if you can just answer yes, so we know what your voice sounds like. And let's see, anything else I'm missing? Sorry. So I'll start with Tim McDonald, Steve Epstein.
Here.
Ed Cosgrove.
Here.
Karen Shannon.
Here.
Rob Partridge.
Here.
Carol Reed. Give me that. Oh, go.
Muted.
Here.
You. Oh, there you go. Still muted. Okay, Diana Acosta.
Here.
Hannah Burnett.
Here.
Karen Mullen.
Here.
Michael, and I'm sorry, Michael, I don't know how to say your last name.
It's Lethan.
Lethan, okay. Talib.
Here.
Tara Gurge.
Here.
Tiffany.
Here.
Zendali.
Here.
Okay, great. And Brown. So we'll open the meeting with, let's see, first item on the agenda would be to review minutes. Does anyone have any comments on the minutes?
Move acceptance.
Second.
There was one small correction I thought we should make.
Okay.
It's the rate of COVID infection. It says 10,000 people. Daily case number per 10,000. I think it's supposed to say 100,000. It's minor, but it probably should be corrected.
Oh yeah, page.
Catch.
But there aren't page numbers. But...
It's under COVID-19 status update, second paragraph.
Right, yeah.
Fourth page.
Good.
yep. Okay.
Great.
Can make that edit.
Okay. Thank you. Okay, what next? Staff reports.
You need to vote, don't we?
Oh, sorry. Oh, do revote. Sorry, to accept the minutes. Or motion.
I'll move that we accept the minutes as amended.
Second.
Okay, all those in favor?
Aye.
Okay.
Aye.
Aye.
Kathleen, aye. Okay. Guess we're ready for staff reports. Environmental health is up first.
Okay. Good morning, everyone. I'll start off by giving a couple highlights from environmental health. So basically, we've again been fielding different items with COVID. Specifically, the most recent item I've been working on is with Community Council and helping them with their protocols with their holiday meal delivery. They've been partnering up with the golf club in Needham, so Brenda Budge has been great. And we've basically been piggybacking off the traveling meals COVID protocols with those, so that's been great. We've already had those set up. So we tweaked them a little bit and we forwarded them on. So they're gonna be able to continue with that program. And this will be for Thanksgiving and then for Christmas as well. So we're still working with them on that setup. Again, you've seen the increase in the mass complaints that we've been still fielding, following up on, and that leads me to the administrative hearing that we had to have with Costas Pizza and Seafood. After our board meeting last time, we continued to get complaints. We had given them many warnings, and we'd still, saw an increase in ongoing complaints. So we brought them in very safely. We brought them, Tim, Diana, and I brought them into the multi-purpose room at the RRC building, and we had the table spread out, chairs spread out, socially distanced, and invited the owner and the son. The son did participate in the hearing, and the owner The father came a little later for a moment, but we did have that talk with him and said, you know, listen, we're having these ongoing complaints. You have to really get on the same page with having your staff wear these masks. They did explain to us there are a couple of staff members that do have medically exemption issues with health concerns, and they're not able to wear the mask. But overall, we were getting complaints across the board of different staff. So, but since that administrative hearing, we were doing well. We were just doing spot checks and everything, reminding the owner to keep up the good work. And then literally the day I had given them that feedback, Tim had emailed another complaint that we got from them. So we had since reached back in touch with the owner again about that latest complaint this week. And he assured me it was the one gentleman that was on the sandwich station that had a health issue. And that's why he didn't have a mask. I said, maybe put him closer to the back of your kitchen. I know it's an open kitchen, but you know, I said, the public are watching you. And he, you know, but he's been definitely a lot better than what he was prior to our hearing. So it makes me feel better. We haven't had to issue any fines to him on that piece, but we do have that fine schedule in our back pocket. We talked to Cheryl Sabara and Diana and I feel comfortable that if we do see it and witness any type of violation, we could issue a $100 ticket for the first offense, $200 for a second, and $300 for a third. And then after the third offense, we could technically shut him down if we do witness these complaints. So he got that message loud and clear, and it's been pretty good so far. So I don't know if Diana, you want to continue with the other highlights?
We had our food advisory board meeting with a couple of stakeholders. I thought it was pretty successful. We discussed potential for food grading and the Nourishing Needham project to continue for next year. I thought it went well. We had a decent turnout. I think it was 20 something people who came. So it's just getting the feedback on what people think for food grading. We're not planning on rolling these things out this year. It was just to introduce the idea and get feedback for 2021 because we completely understand with COVID and everything, adding food grading right now, it's not the right time to do that. And Nourishing Needham, I think we'll just have more time to work out the kinks and kind of build up more of a marketing plan for it, because I think that was the biggest hurdle that we have to go over from last time, was that the program was put together a little bit too quickly. And I just think now that once we have a little bit more time, we can get the word out to the town so people are actually aware of the program and can participate. But it seemed like the restaurants who came to the meeting seemed very interested in it. I think that's the biggest thing. We're continuing. I'm working with Terry still from IT. We've launched a couple more. So from this report, there's more that has been set to live for permitting. So in the next week or so, I'm planning on sending out reminders to the people who have to renew for the end of the year, before the end of the year, to use the online platform. So that'll be interesting because we'll see if there's any issues. Terry's been great because if we find any sort of kinks in the program, she's been awesome at fixing them. The food permit, I think, was the hardest one to do since there's so many different avenues that you can take with it. So we put it on live. I think this is one of the ones that we're just going to have to wait for the restaurants to actually apply for and see what can be improved. And I'm planning on doing some sort of survey to make sure, just asking how they felt about the online permitting. We're trying to make it as easy as possible for everyone. And I think it should hopefully go smoothly. I think that's the biggest thing. I don't know if there's anything that anyone thought needed more discussion. But.
I guess I was wondering about the restaurants with the expanded seating indoors and what's happening with that and how
Tim let us know that we wanted to not let them go free with it. So I think it was decided that outdoor seating, they could expand the seating from the first day, which I think it was October 5th. So this week, or was it last week? Whatever day it was, the first day that they could do it, they were allowed to do it outdoor. Indoor seating is going to be the same as last time, that they're supposed to send us an updated floor plan so that we can verify. So if they have seating at the bar, that there's enough space from the bar. And then when we actually do our regular routine inspections, we can double check on those. Right now, I've only had one restaurant, Latina Kitchen, submit and get approved. I haven't had any other restaurants submit indoor seating. I think it's also because most places can't accommodate 10 people to a table inside. So that's the update on that, but it hasn't. I'll send a reminder just to make sure. And when I'm doing my inspections, I'm checking to make sure that the tables are set apart or at least marked off. So I know, like I went to Poncho's recently, they have their tables still set up as it was previously, but they had tape to mark off the tables that people couldn't sit at. It was just a matter that they don't have any storage space to put those tables. So they just had to put like an X. So the same thing like a Panera, they have stickers very clearly labeled the tables that they can't sit at.
Oops, any other questions from the board members?
Yeah, is there-
Okay. So next, sorry, who's up next? I'm looking through the list. It's a lot of pages, sorry. Lynn, I don't know, do you have any updates?
Really just that I spent much of September writing grants or coaching other people to write grants. So we submitted four grant proposals in September, which was very nice. I also began researching how to write a health equity policy, and looking at racial equity policies as well. And I continue to work with Be Kind Needham. They have been great. I've been getting, I've gotten 2 loads of masks for aging services, and they're very responsive. It's a great group.
Any question? Karen?
Good morning. So our substance use prevention team has big news. As of September 29th, we completed 10 years of the Drug-Free Communities Grant. That is, yes, that is a very significant milestone for the town, and we should all be proud that we have received that funding for so long, and we'll have to think about what we might do to mark that occasion. And in terms of activities, we had we recorded a session for parents at Needham High School through a partnership with the Salsa students. So we had a panel recorded session that we created with students from the high school from Salsa, a parent whose child has used substances, and Katie Coldhart from Youth and Family Services. And the title of the recording is called Insights on a Teen's Life 2020. And it was an attempt to reach out to parents with perspectives on what it's like to be a teen. And it covered a range of substance use issues, mental health, and social emotional issues. So we're eager to have the high school promote that to their parent community. We're hoping maybe to replicate something similar to that geared for parents of middle schoolers in the next few months as well. And we're also in the midst of planning our SPAN quarterly meeting. We have a speaker lined up to come virtually from Ohio, and we're excited about that for October. And lastly, I'm going to have Karen Mullen just share a little bit on an update for our Metrowest Health Foundation vaping grant. We are in the midst of hiring for that part-time grant administrator, and Karen has graciously stepped in to help us with the administration in the meantime.
Great, thanks, Karen. Good morning, everybody. My name is Karen Mullen. I work with Karen Shannon, and I normally work with the Salsa kids primarily, and I've continued to do that, and I'm really interested and excited to start working a little bit on this vaping grant. As you might know from previous meetings, the grant is sort of a 3-pronged multimodal approach to approach youth vaping in Needham. It encompasses cessation services, education about the health risks of vaping for students in Needham, and the diversion program for youth who violate the chemical health policy in Needham. We have really strong partnerships. We're fortunate already with the Needham Public Schools and Youth and Family Services, of course. We know from the Metrowest survey that 23 of our students, the 2018 Metrowest survey, 23% of the students at the high school reported current use of vaping. And the SALSA survey that was done in 2019, surveying the same students in high school, found that 16% of our students who regularly vaped reported that they wanted to quit. And the majority of those students expressed interest in participating in a vaping cessation program to help them quit. So the goal of this, the work that we're doing this year, is to offer this three-prong approach, the vaping cessation program designed for youth, that we really hope will come forward. That's the goal, that they'll come forward and request services. And that'll happen through the nurses, working with the wellness director and administrators to identify evidence-based curriculum that'll be used to supplement the current education in place for our middle school and our high school students. And then the third piece, identify those best practice strategies to enhance the current vaping diversion program. So the two that I've started working on in the last month are the cessation training for all of our nurses. That's happening because Karen did a lot of work this summer on this, Karen Shannon. A program called Calling It Quits Vaping is happening for all of our youth nurses. That's a program developed by UMass Medical School. Their Center for Tobacco Treatment Research and Training. So all of our nurses in Needham will be trained later this month, October 28th. All the nurses will be trained. We've also invited Sarah Shine and the Youth and Family Services Department. Tom Denton will be attending and he's invited his all of his counselors. And Kathy Pinkham will also be attending. She's invited her educators as well. So we're really looking forward to this, this training. The nurses in particular are looking forward to it. They'll be implementing the training. The first hour and a half will be for sort of an overview for everyone. And then the nurses specifically will be trained on how to do one-on-one with students that come forward for cessation. So the nurses are really hopeful that this is a positive, something positive they can be doing for kids that come forward. And the last piece is I've already started talking to our middle school educators about the current curriculum that's being offered for vaping and how it can be supplemented and how we can really help those teachers. And then I'm looking forward in the next couple of weeks to talking to all those, the educators at the high school.
That's great. I know that's been a gap, right, for treating children who are addicted. So that's great. Thank you. Let's see, traveling meals. Looks like numbers are higher than last year as expected. I don't see Marianne, so.
Yeah, Marianne's on vacation today, but she didn't have any insights really to share, just her report.
Mm-hmm. Okay, great. And then emergency management.
Yep. Okay, thank you. Let me start by expressing my sincere gratitude to my supervisor, Tiffany, for helping me all the way, you know. And also, I would like to thank you all, our MRC volunteers, staff members, nurses, for helping make the flu clinics such a success. We simply cannot do this without their help. Let's move on to provide you with an update on completed tasks and what next. First, number one, we received a large amount of PPE from MEMA, and we split them up in thirds between fire, EMS, and police and public health. Two, in September was National Preparedness Month. We promoted personal and family emergency preparedness through social media. For example, we encouraged the public to plan ahead for natural disaster and with COVID. Three, we communicate with the internal and external partners. For example, we contact the police department before the flu clinic to arrange for having a police officer at the clinic helping on the traffic control. Four, we communicated with before the clinic to arrange with our MRC volunteers and staff members, requesting their time and dates when they are available, so they can help us. And the response, it was amazing. We had over 20 participants for each clinic. Let's have a look at this pie chart. It's clear that the majority of participants from MRC volunteers, and that has benefit for our community for short term and long term. Five, we set up I helped with the set up the clinic inside and outside CAF. For example, open up the tents, put in science, 6 feet science and direction, tables, and etc. Number 6, we had a clinic debrief, Tiffany and I, and with all team, we have after each clinic, we had a clinic debrief to discuss what went good and what we have to work on, and also send a survey to our participant at the clinics and public to hear back from them. What's next? What's project we are going to work on? We are going to run through our EDS trailer to stack up again the trailer and be ready to deployment. Thank you.
That was great. Yeah, they've been running really smoothly, so it's great. Let's see. So now Tiffany and Hannah, I don't know who wants to present.
I'll start, and Hannah, feel free to jump in if you'd like. So we have Hannah. I know we've introduced her before, but she started just about a month ago, as of yesterday, I think, officially. So it's been great having her working on getting training, everything up and running, and she's kind of run with the COVID stuff for the last couple weeks. Until we get our new other nurse, our temporary nurse, Mary, will start on Tuesday. So we will also be training her, and she will be full-time Monday through Friday. And she's going to cover about 11:30 to 8 p.m. So we're kind of doing an evening shift on that one to see how that will work out. So lots of training going on in the nursing department. Hopefully it'll get a little more organized. With the training, I feel like I was drowning a little bit when Hannah first started. So hopefully we'll be able to get a little bit more organized with that. And as Talib said, and back at you, Talib, very much grateful for your help, for all the MRC volunteers we had, for all the staff members that came out. We did amazing with our flu clinics. I'm very proud, and I'll get into that later. So that was a big part of our September, getting ready for those. Blood pressure clinics, we restarted those this month, started to do just Wednesdays, 8 to 10, by appointment only. We don't take walk-ins, so they just need to call us, and we've done that. We see about 4 or 5 blood pressures on average weekly, so that's been good so far. Haven't had any other, we've seen the same people every time, so I haven't had anybody else ask. So if we do, we'll look at opening up more times, but for now, we're just gonna stick with Wednesdays. We did the EOC debrief planning with Eliza Cole, and worked on discussing further planning and EOC reopening and things like that. So that was part of our early September as well. And then working on the PrepMod training. So PrepMod is going to be the new system that the state has paid for each local jurisdiction to use as far as planning for clinics. And so it'll be an automatic sign up. It'll be a thing that can send you reservations and updates and reminders via email, or I think it may be text too, but I could be wrong on that. So we're working on getting trained on that so that we can educate ourselves and hopefully have a quick and easy system for when or if we get a flu or a COVID vaccine that will be even more smooth than issue we had with the other one. So that's been our month in advance. Moving into the communicables, as you could see, we decided to do a little bit of adjustment based off of the change in the data from the state and how they're running those and how I can run those now. So the confirmed adjusted under the COVID-19 confirmed is, it went back the last 2 months and showed the different dates or different amounts in those. Not too huge of a difference there, thankfully, but a little bit, especially in the probables, a change in those. So we'll try to do that from here on out because we are going to see multiple changes. The data is not going to be the same from day to day or time to time. So each month we'll do an adjustment because what you see on the weekly things from the state could potentially include people who are at college that will then get moved out, so they won't be in our numbers and things like that. So we'll have those adjusted. So we had 2 Campylobacters for the month of September. I actually was not able to get a hold of either one of them, so they were lost to follow up. Worked with the hospital to try to get some information, but they're just as busy as the rest of us. So try to figure those out, and hopefully we can get a hold of them at some point. Our confirmed for COVID-19 for when I did this report was 23 for September, and then 1 probable in September. Our contacts at that point were 34 for September. So those are those. Lyme disease is still kind of the same, on the same track, haven't really changed much on those. We had 1 dog bite for September and 1 bat. We don't know if it was a bite, but a bat concern on that one. So we did do 1 B12. We are doing those again, just with 1 resident who's called and asked us. So we've started redoing those in our office as well. And then as of the end of September, we did 288 flu shots. So yeah, that was us. I'll just flow right into the next part unless anybody has any questions. Yep.
How does the number of flu immunizations compare to last year in September?
That's in the next portion, so I will definitely answer that.
All right.
Perfect. Okay, so.
Hi.
Ed, I'm sorry, Ed had a question.
Yeah.
Oh, yeah, sorry.
Yeah, I have a question about, several people have asked me, how come we ran out of flu vaccine so fast? So how do we, can you remind me how we get the number of doses? Is it apportioned by the DPH?
Sure. No. So I will also go into that in the next portion because that was part of my flu clinic drama.
Okay.
Okay, so if you scroll down to the influenza clinics on there, again, thank you. Huge help to Talib and Katie Keeman, who was our interim between Rebecca and Michael. She left in early July. Without their plans and their thought process through this, there is no way it would have run as smoothly as it did. So I'm very grateful for all that help that they did. We kind of had some considerations to think about with our flu clinics. Do we want to do, well, of course we want to do COVID-19 safety measures, social distancing, masking, which then led us to how much timing do we have? How much timing can we spend each person in the building? Let's get them out as quick as possible. We needed to figure out a spacing, which facility had enough spacing. Could we do drive up or in person? And then staffing. Staffing was always a concern, especially with how many nurses we had. So they ended up just doing 2 plans for us, which was great. They did a drive-through because that was ultimately the goal. And then they did an in-person flu clinic plan for us. The drive-through was the goal to get to, but just didn't have enough in the nursing department to be able to think through that on my own and work through how I would work that, especially with needing electricity to keep our flu supply cold and things like that. So ultimately we decided to go with our in-person, doing staffing, social distancing, and then just figuring out the timing. So we used ICS as a guide, which was great. I was the incident commander for all respects, but it's also the EDS director for the flu clinics. Talib was our supervisor of our non-clinical staff, and then Hannah was our supervisor of our clinical staff, and it all just ran so smoothly. Getting to the staffing was one of the big concerns, but as Talib said, we've had such a great response in MRC volunteers. stepping up, people wanting to help and people wanting to join our MSC volunteers that we did. We had about 20 to 22 MRC volunteers and staff each clinic, which was awesome. The social distance plan was picked because it was closer to what we've done in the past. It didn't have to worry about power because we were at a facility, so I could keep my cold chain supply going. And it wasn't being used by residents right now, so that was helpful. And then there was plenty of parking space there. So if you have the maps in front of you, this is kind of how it went, our logistics. We had them pull in, and there was this part where they would stop and meet a check-in in their car. From there, if they filled out the form online, they would get their form and they would wind through the MBTA parking lot to meet another tent where they would then get instructions on how to park and when to enter the building. And then as we had a parking attendant, as I call them, who would tell each resident where to park and just say, stay in your car until you're notified that you can come into the building. From there, we had a runner who had a walkie-talkie that went with a walkie-talkie that was inside the building that would then say, okay, I can take this many residents. We can take this many residents. And then from there, they would go through the building flow, which is the white one next to it. So they would enter into the little red arrow, which is the kind of kitchen entrance door, or the dining room entrance door, I guess. And they go in there and they meet another staff member. They would look at which form they had based off of which flu supply they asked for, and then they would direct them to the line. We had 7 nurses in the building, which was great. We had some MRC volunteers and some per diem nurses. They did awesome at keeping track of which flu supply we had and going through that. So they would go to a line, and then it was one-way flow from there. They would walk out from the back and walk straight out. There's like a side door at Cath that goes into the kind of MBTA parking lot side. So they'd walk out that way. So no one really walked through any part of the building, just through the multi-purpose room. Went right in and out. The orange little circles are our waiting station. If somebody hadn't had a flu shot before, they were required to sit there and wait 10 minutes just to make sure that everything was okay. Most people didn't have to do that. We did have a few though, so that was good. The inside just flowed so well. It was awesome. And then after they would just walk back out to their car from there, they get in their car and then to go one-way exit. So it was all one way out. It was awesome. Our supply management was one of the big things that we struggled with during getting ready for this. Like, do we have enough supplies? Do we have enough PPE? And 2 of the major ones were flu supply and needle supply. So tried to just figure all that out. Talib went through the trailer, the public health trailer, made sure we had enough stuff in there. He helped me write up lists that what we had, what we need, how much would we need to do X, Y, and Z. And then we got that together fairly quickly within a couple weeks, which was great. We went with electronic signups this year because we wanted to decrease the amount of paper and the amount of time spent at the clinic. So we did electronic signups. We attempted Eventbrite the first Friday we opened it, and that crashed and burned really hard. So we closed it about 4 hours later. The Eventbrite was difficult because you had to pick a ticket, and then you had to pick another kind of flu supply, which then gave you 2 tickets. And I think it was super confusing to people, especially if they didn't thoroughly read through the instructions, and there were a lot of instructions. So we just ended up closing that out. Some people who signed up on the Eventbrite were good on the Eventbrite. And then we just went to Microsoft Forms. And when Katie Keeman was here, she created a Microsoft Forms, which allows you to just go in and do it's like a Google sheet. You answer all these questions, and then it sends it to me in an Excel spreadsheet that then I can download into a Word document and print them from there. So that's how we did the electronic signups. And the difference with the Microsoft Forms is though the problem was they didn't get a confirmation. So we had a lot of that going on afterwards. I didn't get a confirmation. Can you tell me if I'm signed up? So hopefully once this prep mock gets put together, that will be taken care of. Overall, we had some very positive results.
Tiffany, you're frozen. I don't know if you can hear us. You're in the office, so that's Town of Needham Wi-Fi. Unfortunately. Okay. Maybe you should try logging off and logging back on. I don't know if you hear me. It looks like, let's see, electronic signups. Actually, while we have a second, maybe Talib, you can answer this. Have we figured out a reason why people had to physically sign the piece of paper on site versus do an electronic signature on a form? Like I don't know. That was just one question. Oh, there's Tiffany. Hi.
Hello. Sorry.
Relax.
Said my internet was unstable and then it kicked me off.
Okay. Sorry about that.
Okay, so I'm not sure where you all heard last, so I'll just go back with the residents, some of the great comments we've had from them, and it just so grateful for how well it was done, which just shows a true testament to all of our staff and MRC members who were there. Not only did they come to a training on the 21st, then they came to the actual clinic on the 23rd, and then the other clinic on the October 3rd. So it was awesome. So our lessons learned. So obviously solutions to online registration. Hopefully the prep mod will help figure that out. And then prepping for long-term. So our issues with the flu supply were that we usually go through Sanofi, and that's who we order through this year. And we're saying that they did not, the flu supply, that they couldn't get it to us due to the fires and all the natural disasters that were happening throughout the US. So they couldn't guarantee our time. When I signed up and had talked to them, Tim and Talib and I had all talked to them, we were promised half of our flu clinic supply by the end of August, 75% by the end of September, and then we get the full in October. And that was not the case. So we didn't receive any by August at all. And then 2 days before our first flu clinic, I hadn't received any either. So we ended up buying flu supply off of another town. Another public health nurse said she bought too much, and so she had a whole bunch, and so she gave it to us, which was great, covered us for our first flu clinic. So we had an extra 250 doses. And unfortunately, the problem with the high dose is that I don't get to choose what they deliver to me. So the high dose, I ordered 400 total for this year, and I only received 200 for the first clinic, first two clinics, and then my other 200 has not even been delivered, and I don't know when it will. So luckily, we did order flu block once I anticipated a higher amount of flu clinic residents coming to our flu clinics. I ordered flu block, which is an in between. So you have the regular flu vaccine, and then you have the high dose, which is 4 times the amount. We ordered flu block, which is 3 times the amount. So it's a higher dose. It's not the high dose, and it can be given to anybody over the age of 18. So that is a good alternative for people. Some people still didn't want it. Some people were still very much on the high dose, which is okay. I just unfortunately couldn't supply that with them. So we are looking into different companies to order from, and Tim and I have talked about not putting all of our eggs in one basket. I do understand that there are things with Sanofi and traveling and stuff like that, but this is not the first year that I've had to call them and say, hey, where's my flu supply? I need it. You told me to be here this day. So definitely look.
Okay. I think we lost.
Looking for a different supplier. Within September 23rd, we did 270 flu shots that day. On October 3rd, we did about 520 flu shots. So overall, so far to date, well, minus yesterday, we have done about 810 flu shots, which is awesome. That's already surpassed last year's flu. And yesterday we did a clinic for about 60 people. And then today I have a town staff clinic, and there's at least 120 people signed up for today. So we will already have hit 1,000 flu shots by the end of today, which has surpassed the last few years since I've been here. So we're very excited about that, very proud about that. And unfortunately, I do want to have another clinic. I just don't know when my supply will get here. So that's what we're waiting on. Next is our, so.
Yeah, that seems like a good idea to split between suppliers.
We do also, Tiffany, if you don't mind just mentioning, and I know it's all partially dependent on when we get vaccine or when we know we're going to get vaccine, but some of the plans for housing authority and some senior apartments maybe?
Yeah, so we do hope to, if I get the 200 high dose, and then depending after today how many flu block I have left, we hope to call some of the more senior focused housing facilities and then Needham housing to see if we could hold little pop-up clinics there, different times, different days, couple hours at a time, to try and get some of the residents there. We did order some flu clinic supplies or immunizations from the state this year, but that can only be used on children. So hope to get some of that going, get word out that I have those, and then hopefully Needham Housing Authority, we can get those in place or do in-office visits for that. We did receive a grant also called the Biddles Grant from the state of Massachusetts for $3,000 to help increase our food supply. So that was good. We can use that on anything except for actual flu immunizations. So we'll be using that to help increase our needed supplies to be able to give these shots. So that is the goal. That is the hope for this year, to get as many vaccinated as we can, which hopefully we will be able to continue in the next couple weeks. So.
Sounds like the public is a little bit more focused on prevention.
Yeah.
You've had more people, so that's really great. And it sounds like you've had some significant challenges, which you've been able to overcome and still give more than last year. So congratulations to all of you. Great job.
Thank you. Thank you. I appreciate it. Like, seriously, could not have done it without everybody who came and helped. And that was great. So.
Very well organized. It's great. Do you feel like these lessons learned are applicable to, you know, dare I say, a COVID vaccine? Like, could this be scaled up? I mean, that's kind of the thought, right?
Yes. The goal is to, this process was to see how we could do a COVID vaccine. And I'm not imagining, so we've always prepped in our EDS that we'd have to vaccinate everybody within the town within 48 hours. I'm not imagining that for this. So I'm hoping that this will still work, but we can probably definitely scale this up as needed. So we'll see how it goes.
Okay. All right. Sounds good. So I think that's it on that. Our next item, we're actually 2 minutes ahead. Farmers Market, the revised order for the performance of the Farmers Market. I guess that's Tara and Diana.
Yeah, so this has changed a little bit since Jeff Friedman had a board meeting with his Needham Farmers Market board, and they have decided to just keep as is. They don't really want to change any of their existing protocols. I know the state came out with these revised guidelines, and that's where they were looking at maybe tweaking some items like having minimal touching of the produce, you know, from residents that came in, and maybe looking into using reusable bags. But they've decided they just want to stay steady. It's been working great so far. They've been able to manage the lines and the crowds a little bit better. So that's why they're looking just to stay as is. They still helpful to have on the agenda in case you had any feedback on that. I know that the market usually closes down the end of November, so there's really only like a month and a couple weeks left. But in case, you know, that's all. They just wanted to make you aware that there were updates to the state guidelines, but they're probably not going to be looking at tweaking anything that they currently have. So.
Okay. No questions from any on the board. That sounds fine. Yeah. It's probably easier to keep on to, you know, what you're already doing. So, okay. So our next item, back to this, I guess, is quick updates. Tripoli, West Nile,
Thankfully, as a result, partially of the slightly cooler than expected beginning of fall and the severe drought, or I don't know if it technically was severe, but significant drought. What was anticipated to be a very bad Tripoli and West Nile season never materialized, at least in the greater Boston area. We after reviewing briefly with Mass Association of Health Boards, the board gave me as its agent permission to revise fees in extraordinary circumstances. We've decided to reduce the fees by half across the board. The thing that prompted that was that food service establishment renewals are going out. Diana's working on that. So we needed to determine what the rate was going to be for their new permits. In order not to sort of play favorite to some type of industry that, we know like food service establishments are struggling, but there are others that are struggling. And in order not to sort of be accused of playing favorites, we just did it across the board. So that's a one-time thing. It's in line with what the select board did with lowering the costs for alcohol permits and things like that. At the town meeting, the October town meeting, the town meeting voted to support the costs of extending the sewer line on Walker Lane. The town is paying 2/3. There's a sort of an old bylaw, a sewer betterment that allows the town, that allows residents to petition the town to run sewer on their street, and says the residents on each side will pay 1/3 and the town will pay 1/3. Because there's no residents on one side, the town pays 2/3, residents pay 1/3, but that was approved by town meeting. So that will certainly take some time to actually come to fruition, but that seems to be on track for resolution. I think personally, and Tara, you can certainly jump in, I'm frustrated that we in the Public Health Division and with the Board of Health did not get compliance from the person whose system failed and who I think sort of started the situation. Obviously not intentionally, but their system failed. And then dragged their feet for quite a long time. That said, I do think the connection to sewer is as the best outcome we could get. So I know, Ed, you and I had talked about this briefly previously.
Yeah, I had a question. Now, with the approval by the town meeting, that means that the town will go ahead and put the sewer on Walker Lane, right?
Yes.
Once that's in, will we automatically follow a policy we once had, where as soon as any system fails, they have to connect, or are we just going to ask them all to connect immediately?
The town's going to ask them to connect immediately. There's a very modest cost for them to run the line from their home to the street where the sewer line will be. I don't know if it can be compulsory. I think given the town is spending many hundreds of thousands to bring it, I think expecting them to spend $2,000 to connect to it is not unreasonable. Mm-hmm. I just don't know from town council whether that can be a hard requirement or if it's a when their system fails, they must.
I think that as a Board of Health, we could probably order them to connect. And because I remember in a house I lived in, they put in the sewers. And then as soon as the sewers were in, the Board of Health ordered that by a certain date, all the houses had to be connected.
Okay. I'll talk to Tony Delgazo and I'll talk to town council, but yeah, we can pursue that.
I think that's the best solution, both for the houses as well as the pond itself.
I would think that would have to be across the board throughout the town though, Ed. I mean, we can't just do it in this one circumstance. So if we are doing that across the board, then that's perfectly fine. But if that has not been the policy of the town, I don't know if that we can just, do it just for this one case.
We might want to go back and check some minutes of meetings from, oh my gosh, probably 15 years ago or so, when there was we had a program.
The failed system, like in the Heights or in Greendale, if I recall, right?
Yeah. But there was a town program at one point where I think we were subsidizing building sewers on streets, and then requiring that people connect as soon as it became available. But that was 10 or 15 years ago, probably 15 or 20, actually.
Okay.
So you would put a regulation in place saying if sewer is available, you have to connect anywhere.
Exactly.
Mhm.
within some
Some time period.
some time period within
6 months or a year or something like that.
Mhm.
Yeah.
Be interesting to know how many places this would impact, like how many homes and.
All right, you might have a better sense of that. A lot of the places that we still have on sewer and on septic in the town, which I think is less than 10% of total households, are in challenging locations where there's high ledge or the change in elevation makes things very complicated, right?
Yeah, like the areas of Brookside Road, and, you know, like we're doing a couple on Windsor Road because there's a lot of ledge up there. So it's the tricky sites that have a lot of gradient issues, I think we find, the outlying areas are still septic.
Okay.
But we'll look into that. Tara and I will talk to town council and Tony and go over those issues.
Okay,
We can bring it back at the next meeting.
that's good.
Tim, do you know if is there a sewer connection fee that the town applies to each house that connects, other than the cost of digging the connection? Is there a fee for connecting?
I imagine, I just don't know what it is.
I know they have to pay, there's an application fee, and they do have to pay from the line from their house to the street. So, but yeah, there is a fee involved.
Because depending on what that fee is, you know, people could certainly be incented to connect by offering a lower fee. In addition to the mandate. If by a certain date you get a lower fee, after this date it's higher.
It's a good idea.
Two other sort of quick updates. The town received designation at the end of September as a municipal, an MVP community. So we've gone through a assessment process as part of the Municipal Vulnerability Preparedness Grant. We've also done a hazard mitigation plan. And those are things that will position us to apply for action grants, which essentially the grant we got was a planning grant to go through a year-long process to get this certification and do these plans. It makes us eligible for action grants in the future, which would largely focus on things that would help the town adapt to extreme weather effects of climate change, like repairs to a culvert or improved drainage in particular low-lying areas or things like that. So that's a positive thing. It's a sort of interesting sort of spot between public health emergency management and public works and conservation commission kind of all in there. But it's something that Rebecca was leading. Kim Donovan from DPW took over and kept me in the loop for the final steps. And it's something that, you know, Michael's going to be working on with the folks that I just mentioned in the future. Briefly, and I had sent this around, this Commonwealth is doing a community impact survey. They're really trying to understand all communities, all sectors, all groups, how COVID impacted people. They're pushing it out as broadly as possible. They're not just interested in the opinions of boards of health. They're sending it to schools. They're sending it to community groups, faith-based organizations. They're really casting the broadest possible net. But they're looking for people to take, you know, and it takes about 15 to 20 minutes. They say 10 to 15. It actually took me more than 15, but I think it's a valuable survey. So if people can sort of be aware of that, hopefully the people on this call can spend a few minutes taking it and letting other people know. Importantly, I think they're really sort of struggling to reach out to, or not struggling, they're making an effort to reach out to and have not yet gotten as great a level of participation from communities that maybe not English-speaking populations or specific sort of ethnic or racial groups where there's not as strong connections already. So they're really trying to make an effort to better understand how COVID impacted those groups and peoples. I think that probably brings us to, unless there are questions about that, the COVID update, which is probably going to take up a very good chunk of the rest of the meeting. I know there's a particular point that I wanted to do a brief presentation, just the presentation I sent you last night to go over. I know Tiffany had some data. I don't know if you want to start, Tiff.
You can go ahead and start. I'll pull mine up and then go after you.
Great. So just fairly briefly, because I did send these to you last night, this is the same sort of format as what I had sent you previously, but the data wasn't the data until I presented it last night. Looking at sort of trends, focusing on Needham, surrounding communities. As folks know, I think Needham is at the intersection of Norfolk, Middlesex, and Suffolk counties. Needham touches Boston, which is Suffolk County. Needham is in Norfolk County. Needham touches Newton, which is in Middlesex County. And the population of the Needham Public Schools obviously is drawn from both the city of Boston with the Boston students and the town of Needham. And the staff from the Needham Public Schools comes from many communities. It extends, you know, some folks come from New Hampshire, some from Rhode Island, maybe some from Connecticut. So understanding the risk level or the spread level is not as simple as just looking at Needham. It's sort of trying to understand Needham's, how Needham fits into the picture of the regional whole. You know, that said, there are communities that are struggling quite a bit, and Needham is in, you know, Framingham is struggling quite a bit. Needham is in a better position than Framingham in that context. Excuse me. This doesn't tell a whole lot. I think some of the maps and the graphs show a little bit better data, but you can see that many communities, Needham included, are in the yellow. Needham has ticked up this week. Last week was our first week in the yellow. Yellow is part of the state's sort of color coding system, which it rolled out in the second week of August to look at whether schools should return to hybrid learning or stay remote. They define green as less than 4 average daily cases per 100,000 population over a 2-week period. 4 to 8 is yellow, 8 and up is red. Needham has been green most of the time. There was 1 week where we were gray, which is we were even below green. We've been trending up fairly consistently. If you go back about a month ago, 4 weeks ago, you can see quite a lot of green in the area around Needham. A little bit more yellow and some red, more yellow and red. And so you can see that there are still plenty of communities that are green, but it seems like around Needham, there's been some uptick. Dedham obviously ticked up to red and then is falling down, falling back sort of towards the yellow.
Tim, when you talk about average daily cases, are we talking about new confirmed cases? Are we talking about the case load? You know, there are a lot of different stats thrown about. I want to make sure we know what we're talking about.
So all of the new cases that came within a 2-week period. So for this last 2-week period, which was from September 20th to October 3rd, Needham had 21 cases over a 14-day period. So that's, you know, 1.5 cases, but you have to adjust per 100,000 because Needham's not 100,000. So it ends up basically you just slightly more than triple that 1.5, and that's where you get the 5.1.
And since these numbers are very small, you know, has anybody looked at a confidence interval around these numbers? I mean, I understand their exact numbers, but you know, as you start to adjust these things, what's the likelihood that this is random effect versus, you know, what we should be expecting to see?
Good point.
No, we have not performed any confidence intervals on that.
That's a
I
good
don't think we
point.
could ask the state.
Yeah, it's a good idea. We could do that with the data you have. I mean, just
Yeah.
only 14 numbers, but it's still, you could get an idea. It's probably not normally distributed, but yeah, we could work on that.
Right. I mean, remember, it's not a statistical sample. I mean, you know,
Right.
it's actual numbers. So, I mean, it's not quite the same thing. But I think you see what I'm getting at. It's just the numbers are so small. We expect some random effects anyway. How much of this do we need to worry about, and how much of this is the numbers are so small that we don't really need to worry about it? And where's the break point?
Right, like it's unstable. I will say that the state seems to be ticking up to, you know, just slightly. But again, I think you're right. We're way below where we were before. So it is smaller number, you know, it's small numbers, I think. Yeah, no, that's a good idea.
Yep. So just briefly, you can sort of see that's the average daily incident rate over time. Quite a busy chart, but you can see that Needham was generally one of the lowest for a very long time and has gone up quite a bit. And you can see, you know, Norwood has fallen down. They started a little bit higher. Newton has been pretty low fairly consistently. You can see Boston and Framingham, you know, always in the yellow or the red. The other thing I want to briefly sort of show, and I think this is somewhat interesting, it gets a little bit in the weeds, is so if folks see, you see, the state changed the way it looked at percent positive cases back in early August. And I don't think this, I think I was technically aware of it, but I didn't realize the significance of it. So I think Boston is the best case to sort of illustrate this, and I'll hopefully pull up the state website as well. If you look here, you can see the average daily cases in Boston starting from the first week the state released this, which was second week of August, going from 6 to 6 to 7 to 7 to 7.5 to 7.8 to 7.9 to 8.5 to 10. So fairly steady increase. If you look at the percent of positive tests in Boston over that same period, you start out at 2.3 and you continue down to 2.1, 1.8, 1.45, 0.9. And this week is actually, or this period is the first time it's gone back up. It had been on a steady downward trend for a number of weeks, even as the average daily cases in the community have gone up fairly significantly. I'm gonna try to figure out, give me one moment, let's see. The reason I mentioned this is I wasn't fully aware until looking at that and then considering it in the context of this article from the Globe. I think folks should see, let's see, right here. So the Globe noted how the state started changing, again, starting August 12th when it first released this data about average daily incident rates, which is to inform sort of school opening, the way it calculated percent positive tests. And basically, previously it would take out if you were tested multiple times. And I think that made a great deal of sense when the people who were getting tested multiple times were largely in the first responder and healthcare worker community because of exposure during the workplace setting. So most of the people that got multiple tests in May, June, July were, you know, healthcare workers and EMTs and paramedics. Since then, you know, the economy has reopened. Some large employers have instituted regular testing, and notably a number of private schools and colleges and universities have implemented regular screening tests of sort of their broad population. The state changed the way it calculated the numbers so that every time someone was tested, it would drive the number down. So a community like Boston with, you know, multiple large universities and multiple large employers saw a percent positive testing rate drop significantly, even while the number of cases in the community went up in, you know, very steadily. So I think it's something for us to be aware of. I mean, the state has changed the way it does the data. It's not necessarily that this way is wrong. I think it does not give as clear account of the community at large, because we're not doing sort of population level screening in the community. We're just doing it in these certain subsets of Northeastern University, Boston University, the people working on the production line at Gillette, or, you know, something. So it's a real sort of limited subset that maybe distorts the accuracy of the number of the percent positive in Boston.
Good point.
I think it's just something for us to be aware of. When I meet each Thursday night with, it's the superintendent, the director of school health services, Barbara Singer, Dr. Stern, the school physician, Dr. Geller, who's a professor at Harvard School of Public Health, and a couple of, one school committee member, one assistant superintendent, and a number of union representatives. We look at the data to basically look at, you know, is it safe to keep operating schools in Needham? So we take into account all of the data on cases, all of the data on testing from Needham and surrounding areas, We also look at qualitatively, and Kathleen, I think you were the one who gave me this idea, what the compliance level is. So what are the principals assessing? Like, does it seem like kids are keeping their distance? Does it seem like there's good mask wearing? Or, anecdotally, we're already getting reports that kids basically whip off their masks the second they're out the door. It also takes into account, are the HVAC systems working as intended? So the town spent a lot of money and a lot of time repairing, re-engineering, retrofitting its HVAC systems, and where there weren't HVAC systems, putting in place fans and HEPA filters and other things to exceed 4 air changes an hour, so to exceed the ASHRAE standards. So we look at sort of qualitatively if the town is meeting those sort of safety measures of good air handling, strong compliance with masks, strong compliance with distancing, and we combine it with the data. That's sort of the slides that I send you each week. Tiff, do you want to pull up your more Needham specific info that you prepared?
One thing that would be useful, Tim, when you're looking at those slides is I'd like to see where we are compared with, say, April, May, and June of this year, because I think we're actually back up to where we were in May.
The other thing is a state update provides both ways of showing the percent positivity. So actually we were just discussing this yesterday for our company, which number should we be looking at? And yeah, it's less than 1% by the one method and about 3+% by the other method. One is like counting people versus tests. There seem to be, and when you look at all the different calculators and things that are online, they all use different methods somewhat. So, because it varies by state, right? How it's being reported.
Absolutely.
Right, but usually the 2.5% positivity rate is where you begin to start to worry, and we're ticking over that now. One other thing to consider, Tim, and I don't know if this has been brought up, but if you go back to that graph of Needham where you showed we had a rather rapid rise over the past 2 weeks, we should probably be looking at the slope, not just the absolute number, because the slope is going to give us an early indicator before the absolute number. And when we see that slope rising dramatically, we need to start seriously considering scaling back, opening.
So I'm definitely open to ideas on how to sort of look at the data. And obviously one of the things that I've mentioned to the board previously and Lynn referenced is we did apply to the Metrowest Health Foundation. They have a funding opportunity right now for public health infrastructure support in the context of COVID. Lynn put together a good application that we're hoping is going to get funded to fund basically epidemiology grads to help us sort of dive deeper into the data. But I think sort of whatever we can do now to improve the data would be great, or to improve sort of how we present it or what we're considering. And then once we hopefully have someone with A, more time to focus, and B, sort of more direct skills in this area, I think that's hopefully when we can also start doing something more sophisticated on the regular.
It just doesn't have to be us. I mean, you've got this whole committee working with the schools too. And do we have I mean, I know you're our representative there, Tim, but do we have anybody from the board who actually participates in that, or could one of us be there?
I can ask the superintendent. It's not a public meeting. There is another group which Christina is on as in a parental representative role, which is the school advisory. I think that's sort of a broader swath of the community. I think actually we have a meeting coming up this, maybe is it Wednesday, Christina?
Mm-hmm. Yeah, I think it really makes sense for us to have some representation though on that health and safety committee. Yeah, Tim, I had a question too. I was looking at that slide, where you kind of, tied up according to age, what, the cases were from 9/20 to 10/3. Are we going to have any information on kind of whether these are, children who are in our public schools?
Mm-hmm.
So I think, and Tiffany, feel free to jump in at any point. I think we always want to be careful to sort of protect to the greatest extent possible the sort of medical privacy of cases. We know in this instance there are some some students from the Needham Public Schools in here. There are some students from the Needham Public Schools who had not yet started in-person learning. And there are some students from not the Needham Public Schools. So it is, it is a pretty broad swath. It includes all.
Yeah, I guess how will we know then, how this impacts schools if we don't have this information?
I mean, don't get me wrong, we do have this information, but again, it's protecting people's privacy, so it won't come from the nurses. So as soon as trying to decide what's the best route and how we can do it without it being pointed to identify the certain individual, then we can potentially share that information. We just have not figured that out yet in the realm of the small amount of cases we have.
Schools are also looking at putting out a dashboard that would identify the number of active cases and the number of contacts in quarantine in the school setting. Yesterday, after some urging from me and Barbara and Dr. Stern, they agreed not to separate between students and staff because if you have one case at the high school and it's a staff member, it becomes very easy to figure out who that person is. I don't know yet how they'll break down in terms of buildings, but that's going to be data that the schools have based on the information they provide to us about the close contacts of cases in the schools.
All right, so I will go ahead and,
I'm going to stop share.
Perfect. Okay, so I'll try kind of just go through all mine. I did a quick data update. I'm going to leave my video off, so hopefully I won't get kicked off again. I'm going to do a quick COVID update as far as total cases, our monthly cases, and then a snapshot of September. And then I will go into a little information about the CTC and what we've done with them. Okay, so here is kind of the slope that Stephen was talking about a little bit earlier. This is our total amount of cases we've had since January 1. This data also did not have time to do this, but at some point rearing probably mid-August, the state fixed the ability to be able to pull our report based off of lab dates and positivity instead of create dates in Maven. So previously, the reports I had pulled would go off of create dates. So if somebody had been tested multiple times, it would go back to their original test, even if it was negative, and that would be the amount of reports I would get per day. So as of the September times, about mid-August through September, I was able to pull off of lab reports. So I'll have to do a more specific dive into our previous cases to change this a little bit. But currently, the second portion through August and into September is correct off of lab dates. As you can see here, we are starting to see a rise in our cases again as of about mid to early September. We saw a little bit of an increase in July and just a slow, kind of, I don't know if you call it slow, steady increase in August, but we are seeing a rise as of September. Our total daily cases, again, since January, which started in March, as you could see, these are just the numbers we get per day. So the ones with no lines, there were no new cases that day. We did definitely have a lull through August, and now we're into September and starting to see more per day as the month goes on. This is our total cases, both confirmed and probable. The blue is the probable. This is a snapshot of all the cases we've done. So the blue hasn't changed much because I think people are finally getting the word to continue testing only with PCR due to it being the gold standard and the state asking that if you get antigen testing that you also get PCR tested. So you might as well just get the PCR. So our probables, which are antigens, have remained pretty steady. We've only seen one or two throughout, I think one through September, and then maybe 2 or 3 throughout August. So, and then here's September's breakdown by age. with the largest group being between 19 to 34. Then our second largest being 5 to 18. And as you could tell, a lot of that correlates back with our last week in September that you saw in the data that Tim presented. And then 7 within our 35 to 49. And as of September, we had 0 in the 65 and older age range. Okay, so that's it on that one. So with our CTC, does anybody have questions on that before I go on to the CTC data? No, okay. So just with our quick CTC report as of September to date, they took on 49 cases for us and then 45 contacts. About, not last week, but the week before, Hannah has been the point person for most of our cases and taking those. So we haven't pushed any to the CTC as far as on purpose. If we missed one over the weekend, it did go to the CTC. But other than that, we've taken on every case since then. It can be a lot. It definitely is a lot. One thing we are seeing is cases, and as Tim can attest, contacts have been crazy. So we have one case that had 43 contacts, and then we had another case that had 41 contacts. Currently, right now in our state of staffing, there is no ability to take this on. We do not have the time, the ability, nor, to be honest, we don't get paid overtime to work 24 hours a day. So taking that on is just not possible if every case we have from here on out has 40 contacts. So we really need to start educating people on, please pick your battles on what you prefer to interact with, because the more you interact, the more the spread there is. And I understand that we are really trying to get people out and get people focused on school and activities and trying to improve people's mental health. But we also need to remember that we are still in a pandemic, and we are seeing increases not only through us, but through other places, New York, different communities around us. So we need to be very aware of that. The CTC, I spoke with them. I have a bi-weekly meeting with them. I spoke with them on Wednesday, asked them what their average time was for turnaround. If I send something to them, they said it depends on when it goes through the system, because it gets dumped twice a day to them. So at the most, somebody would be contacted within 24 hours. But again, if I dump it to them in the early morning, then that's probably the longest time before somebody gets it to them, versus if it were to go to them in the afternoon, they could get to them the next day. So it just kind of depends on that realm. But I've had a great relationship with our liaison through the CTC. Just a couple of things. We have had a couple of outbreaks in a couple of businesses that they took on for us and worked through, mostly because the staff members don't live in Needham, so they've notified us, they've contacted us, just let us know, which has been good. And then their report on our travel-related quarantine. To date, we have had 1,318 residents with travel-related quarantine, so that's been awesome, knowing that people are doing that and making it aware to the state. So yeah, I think that's what I've got on there.
Tiffany, I know we're looking at the Needham data, but as Tim mentioned, we're also looking a little bit at our surrounding communities. So do we have data as far as daily cases on our surrounding communities, and could we produce a graph of that as well so we can keep track of what's happening around us? I would just loop it in. Sorry, go ahead.
I can't look at any other town besides Needham, so I can't pull that data.
Well, I'm wondering if we ask other towns. I mean, we've done collaborations with other towns. We've got a Chinna and the like, but it would probably be useful for every town to share data with their surrounding communities so that people have an idea of, of what's coming in. Because this idea that the governor has of allowing, individual communities to make the call in terms of, green, yellow, red, and reopening in part 2 of phase 3. Personally, I disagree with. I think that, COVID doesn't respect town boundaries, particularly small towns, and Needham is relatively small. So we need to be looking at a little bit broader area.
I agree with you there. And we could, I don't know that I will be able to do that until after we get everybody up and running and trained. But I do know that a lot of our contacts for the cases that we've done recently have not been in Needham. So yes, it's definitely crossing other boundaries as far as that goes as well. So that is definitely something we can put
Yeah,
on
so
the
I'm sure,
pipeline.
Tim, you're in contact with your counterparts in, you know, in Wellesley, Newton, West Roxbury, and the like, I'm sure, right?
Yeah, yep.
Yeah.
So you're talking about contact tracing data, or you mean cases?
No, case data, not contract data, yeah.
Oh, so there is weekly data that gets published by the state that we're actually, hopefully by early next week, I should have a dashboard together that we can monitor, and it would have all the towns in the state. So that gets published weekly, so you can at least see the trend for the week. So that would be, and that's kind of what Tim has been pulling and turning into that PowerPoint each week. He grabs some of the surrounding towns too for comparison. But once
It was pretty compelling looking at the graph that Tiffany had for daily. It'll give us a little bit more of a sense.
So I don't know how you get those data without talking. Yeah, so daily would be another.
That'd be a talk with each of the towns to share data on a daily basis. Yeah.
Yeah, that would be interesting. Okay. All right, so we are, any other, so I guess maybe our next item, is that sort of all the updates on those? We have the schools, town meeting, we sort of covered that. Oh, elections, is there something to talk about there?
So there were some Facebook comments about people feeling that there weren't adequate spacing, or that there weren't enough supplies. There was some confusion. During the September primary election, there was some confusion because at least 2 locations, the sort of supplies of masks and hand sanitizer and wipes were returned unopened to the town clerk's office by the election staff. So it's unclear exactly what the sort of issue was there. But both the town clerk and I are going to work hard to make sure that each polling location is spread out. Each one has enough masks for all the staff and for any attendees that don't wear masks because they can't be denied entry. But we will strongly encourage anyone who doesn't have a mask to put one on, unless there's a medical reason they cannot. Plus hand sanitizer and wipes. So we're hoping that'll sort of resolve that issue, which was largely an issue of some email and voicemail complaints and some posts on Facebook. Fall town meeting went off pretty smoothly. I think, I don't know if it's going to become the norm, but certainly there's some aspects of it I think that are valuable, especially the recording of presentations in advance, which cuts down on the time that the proponents like the select board or the finance committee or the planning board talk. And I think the next item that we had within that packet, Tiff, did you cover coordination with the CTC? Did you say all you wanted to say about that?
Yeah, I believe so.
Okay. Then the Needham Public Schools is sort of the data that I presented earlier, which I think the board gave me some good feedback on. And I think a lot of it will sort of depend on the capacity we have, especially if we did get an additional staff member, part-time staff member to help. That would be huge. The face covering order, which the board has put in place and voted to revise and maintain over the course of the past few months, has been redlined and is in the packet. There are very small changes, and they're reflective of the changes that that were included in the governor's orders of the past couple of weeks about phase 3, step 2. From sort of my opinion, which I think I shared with the board, I think I'm not entirely sure why they went to phase 3, step 2, although the impact on Needham is rather minimal. Needham doesn't have concert halls and outdoor concert venues. It doesn't have trampoline parks or laser tag arenas. So it was actually a very limited impact on Needham directly. So what is proposed in front of you is a red line version that just makes modest adjustments based on phase 3, step 2 of the governor's order, and includes, I think, under 5B, instead of a recommendation, a hard requirement for visual markers. The vast majority of businesses have responded to that by putting in visual markers, but this would just require it. If there is anyone who expresses reluctance about that, it would be clear that it's not a request, it's a requirement. The order as currently exists would cease or would lapse at the end of November 13th if the board chooses to do nothing. The board's next meeting is scheduled for November 12th. So if the board wishes to reevaluate at that time, it could choose to revise or extend the order. But my recommendation to you is to consider the red line version here and whether the board wants to adopt those.
Any comments from board members? Not that big of a change, I think, although 50% of your occupancy could be a lot. I mean, we can't, I don't know. It's, I don't want to change it. I think I'm fine with how it is. There's one typo where it says may allow up to 10 person, including staff, just needs to be persons, I guess.
Okay.
So.
Sorry, I'm on mute. How is occupancy actually determined?
Yeah, it's vague.
What is 100% occupancy? Is this fire code? Does this have any relevance whatsoever to air quality?
No.
I don't believe it has any reference to air quality. It's fire and building code. So it's the building commissioner, Dave Roach, and the fire inspectors that usually give us that information. Tarndine, I know you did some work in the spring talking to them about what the numbers are. And in some cases, it was less than clear what the numbers were. It took a little bit of doing to find out what the occupancy was.
Yeah, I mean, it is a fire code based occupancy. If you want us to look more into that, we can.
Yeah, I just don't know if it's based on square footage. Is it total square footage for the building? I'm a little bit more concerned about square footage where there would actually be patrons seated, for example, rather than the kitchen. I mean, I think those are considerations we need to know what we're dealing with.
Yeah, we have to just determine by building, because I know, for example, the Needham Golf Club, they have occupancy per room, but I'm not sure if it was set up that way because they have different functions. But then if I go somewhere like the Village Club or VFW, it's not as, I don't remember seeing it as clearly marked as it was at the golf club. So it just depends on where you go to see where it's marked. But I don't know. I think it's the fire chief who has the numbers somewhere for each building.
It is based on square footage and acres.
Yeah, because I don't know how relevant that is for our purposes. It might be very relevant in terms of getting people out of a building for a fire. It might have very little relevance for keeping people socially distanced in the time of a pandemic for a restaurant.
So I think that's a good point. I don't know what we would substitute for that, though. And so the board does have as an option to be stricter than the governor's order, and has in some instances already done that. So if we were going to substitute, I think we'd have to really figure out what to substitute, and it would be no small thing to work with sort of establishments that already sort of understand roughly what this means from like the building commissioner and fire perspective, and substitute in a different one, because there would still be those requirements in the context of not exceeding building and fire codes, but then there'd be a new sort of one for public health, not exceed capacity in a COVID context. We'd really have to, if the board wanted to go that way, I think we'd have to really be clear about what the requirements are and how to understand them, and we'd have to do a really good job educating establishment community.
Yeah, and I just wanted to add that I've been trying, when people ask me questions too, I think people are getting confused. So like at one of the, like a hall, they see the guidance for like a restaurant, they're like, oh, we're eating, and they automatically want to use the guidance for restaurants, which doesn't have that capacity limit, but then I have to remind them that they have to use the event guidance instead. So just because a restaurant can have X amount of people in it, you're running an event, so now you're subject to like the 25 person limit inside, 50 people outside. So it's just, I think people are crossing the guidance and trying to use the one that they think makes most sense, but I'm definitely trying to educate people on which is the right one for what they're doing. Because I remember in the state calls, it comes up a lot, like if I'm in a restaurant and a band is performing, which guidance do I use? So it depends. If the band is the main event, then it's an event, then you have to follow event guidance. But if the band is just playing in the restaurant and the restaurant is functioning just as a regular eating establishment, then you would use the restaurant guidance. So it's definitely that education piece that has to get out there.
Can you just leave out the or 50% of the maximum permitted occupants? Can you just do 10 per 1,000? Is that more, I guess it is more stringent than the state, right? It's a little easier to understand.
Yeah, I mean, given our number, I mean, I think there are a couple of things. One is I just want to understand where the fire and the building stuff, comes from, because it's very possible that they already took into account that, most of the patrons for an event or in a restaurant are in one area. They're not going to have easy access, or egress, through a kitchen or something like that. So if they've already taken that into account, then we're probably fine. Mm-hmm. Given where our numbers are, personally, I'm a little uncomfortable going to 50%. I would entertain going to maybe a third. I think that might be more prudent at this point, but I don't know how others feel.
What are the establishments that don't have a occupancy limitation?
There are no establishments that don't have an occupancy limitation. The question is whether it's clearly posted, whether they know it, or it was something when the building was first built that they're vaguely aware of and exists in paperwork, but they've never really considered. I believe, and Diana, you can correct me if I'm wrong, I believe the previous standard, which we've had in place since the beginning of phase 3, was 40%, or no, yeah. was it 8 people or 50%, or was it 8 people or 40%?
I think it was 8 people and 40% before. And Christina, when I said no limit, the restaurants are limited by the space, mm-hmm. obviously with their fire capacity, but usually with the space, it doesn't reach that high. But you can, as you have space to fit as many tables as you can with 6 feet apart distance. The restaurants weren't explicitly given like a 25% capacity, 50% capacity. It was just restricted by space. So that's what I meant by the no capacity limit. But yeah, I'm pretty sure it was, the last phase was 8 per 1,000 square feet and 40%. So now it goes up to 10 per 1,000 square feet and 50%.
And do we have any areas in town that, potentially have the ability to have very high numbers of people at the 50% rate that would still be in compliance with this order? Or, are those places just not bringing a lot of people, or?
I don't know. Tara, do you?
The only one example I can think of is the Cafe Fresh Bagel that we got concerns with it being packed in the morning. And he had it posted around his door, 10 occupancy only. And what would happen is that these groups of kids would come in 5 and then they'd fill up and over the capacity. So that was one example we heard about.
I only know from an office perspective, and I mean, we could have had 180 people or some crazy number in our space, just at the, 10 per 1,000 or something. So I know obviously nobody wants to do that, but.
I mean, I guess I agree that I'd probably be more comfortable with a smaller percentage, but if it's not actually an issue right now, I'm okay with the wording the way that it is. But if we start to have numerous Cafe Fresh examples, then we would have to reconsider.
That's certainly something, and Tara and Diana could monitor that compliance and specifically call it out at the next meeting in their report, if that's helpful.
Yeah, we could do that.
Yeah, and I was gonna say the overcapacities is similar. I think it happened at Starbucks, that it was just a rush. Someone had called me, it was like 10 a.m. and I went up 10 minutes later and no one was there. Like they were there at the peak, lasted 5 to 10 minutes. By the time I got there, it had already dispersed. So it's just depending on the time of day sometimes.
I think that I'm kind of fine with that. I didn't realize it was such a small change, like from the 40 to 50. I can't imagine. It's like, I don't know how many people that would be, but not that many, it seems like. So I guess I think it's probably fine. Just leave it as is.
I think I feel similarly.
Okay. Steve, do you feel like you need more information? You want like an analysis of what this would entail? I mean,
I'm whichever is greater. I don't know. Again, it really depends on, what this is. All of the indicators are going in the wrong direction right now. It'd be one thing if things were flat. They're not flat. Okay, we've just reviewed all of this data. Every community around us is going up. We are going up, and here we're relaxing restrictions. That just doesn't seem to make sense to me. All right, right now we're just seeing, incidents. After that, we'll see deaths. That's how this goes, right? I mean, we know that the deaths are coming probably about 2 to 3 weeks from now.
Yep.
So let's not make the same mistake twice that we did in the spring. I think we've learned enough about this virus at this point. So that's why I would urge some more caution.
So from your perspective, would that be accomplished by saying are limited to 10 persons, including staff, per 100,000, and then getting rid of the or 50%, or saying 10 persons or 50%, whichever is lower?
That might be the way to do it. Again, it depends on what this, permitted occupancy number really means, because I don't think I have a good grasp of, I mean, yes, it's a fire code thing, but what does this practically mean? Because I don't know how is that based on per 1,000 square feet? I mean, the two things look like they're probably related in some way. Does anybody know how those are related? Because it looks like, per thousand square feet is probably something that's related to the fire code.
it says, sorry, I just found the state guidance. So it says 50% of the building's maximum permitted occupancy as documented in its occupancy permit.
Okay.
So.
Right, but how do they calculate that occupancy?
We could talk to the building commissioner and the fire inspectors to figure that out, certainly.
Yeah, because I mean, it may be per 1,000 square feet, and then we can come up with some numbers. Because right now you're basically putting in an apples and an oranges, and we're not sure what we're dealing with.
And it's funny. The next thing in the guidance says, in any case, no enclosed space within the building shall exceed occupancy of 10 persons per 1,000 square feet. So you kind of can't go above that anyway. So I don't really understand the 50%. It doesn't really help. I mean, it doesn't. They sort of contradict themselves in the next bullet.
I believe that's pulled directly, Diana, you might know, I believe that's pulled directly from the state website, I think.
Yeah, that's what I mean. That's what I'm looking at.
Oh, okay.
Yeah. And so it's just funny. It's that the up to 10 includes staff. So if you have 3 people working behind the counter, you've got 7 customers.
Right. I mean, I would at least put in, whichever is lesser instead of whichever is greater. I mean, and remember, that other thing is for ones that don't have an occupancy, established by fire code for whatever reason.
I mean, we could just say 10 per 1,000.
That might be correct. I just don't know if there's any place where 50% of occupancy is actually less than 10 per.
Yeah,
or
right.
greater than 10 per, right?
Mhm.
Because again, we're not sure where this number's coming from.
Can we just switch it to lesser? Is that, are people go with that?
I think so. Then that solves the problem. At least it'll never go higher than 10 per thousand.
Right.
Okay, and then the next question, is it less, lesser, or fewer?
All right. Uncle.
I'll do some grammar checks on that one.
Thank you.
I think it's fewer.
Or if, yeah, it's
I
because
think
it's
you're right.
persons, so fewer persons.
You're a person. Okay. Okay.
You
So,
could debate whether, if it's whichever are or whichever is persons.
okay, great. So Christine, do you understand the edit we're talking about? We're just saying, just make it, whichever is lesser / fewer. Does that work for you? You're muted.
Yes, it does. I know. I was trying to see if I could find something about how this that's calculated, this 10 per
The
thousand.
occupancy thing. Yeah.
Yeah.
I think we worked it out that with the 10 per thousand square feet and 6 feet apart, you can't really get much above that.
No, it's not quite there actually. Remember, because if you have 10 per thousand, all right, 1,000 square feet, that means that every person has 100 square feet.
Yeah.
Right?
Mm-hmm.
So if I'm standing in the middle of 100 square feet, I'm in the middle of a 10 by 10 box, right? So if everybody is standing, you should be able to socially distance because you would be 10 feet apart. If everybody were in the middle of that box, they'd be 5 feet from the edge.
Mm-hmm.
Right? So then you should be fine.
Yeah, I was just on FEMA's. They seem to have something. It says one conservative approach to converting the CDC 6-foot separation criteria to an occupant load factor is to calculate the area of a circle with a radius of 12 feet, which is equal to approximately 113 square feet per person. This approach accounts for instances when people might be standing along a wall or might not be standing in the center of the circle. To understand the implication of this occupant load factor, compare it to those used to design the means of egress for the various occupancy types discussed above.
Yeah, see, this is the discussion that I think we need to, we need to just work out the numbers offline. But, we're talking, you just mentioned 133 square feet as your 12-foot radius circle. Here we're talking about 100 square feet. So this is a little bit more congested than what's recommended in what you just read, Christina. 20%. So I think the lesser certainly would be prudent based on that guidance.
Yeah, I think so too.
So, and then I guess the only other comment is, we keep extending this face covering order. Should we just do it to the end of the year?
Yeah.
Okay. Yeah. Is that okay? Or till our January meeting or something? Nothing's changing. I sadly think we might be wearing masks next summer, but do we make it like I don't know when we usually have, maybe mid-January or something?
Yeah, till our January meeting.
Okay. Which we don't have a date for, but we could make it like January 15th or 16th, which would get us through, to the third Friday in January. Does that make sense? January 15th, 16th, the 16th, just in case. Okay.
Okay. And so, sorry, just to confirm, we're keeping the language, but saying whichever is fewer, greater, or fewer, and then we're going to sort of do a little bit more research on what goes into the maximum permitted occupancy between now and the next meeting and discuss it further. Is that right?
Correct.
Yeah.
Great. Okay.
So we need to vote on this now to be able to extend the face covering. So with that edit, do I have a motion to accept this revised regulation?
Sure, I'll make a motion to accept the new face covering.
Okay, I'll second the motion.
All those in favor? I guess I have to call names. So Steve?
Aye.
Ed?
Aye.
Rob,
Aye.
Christina,
I,
Kathleen, aye. So we'll accept that with those revisions. And is that everything, I think, on the agenda? Oh, housing guidelines. Is that the last item, the 40B?
Yes, so the last item, just pull that back up. Sorry, I was making the edits as we went.
Yeah, no, sorry. It's the extending the subsidized housing requirements to, now that we've met the 10%, right? And so now including it for any future developments. Is that correct?
Right. So I think it's just a question, and I think one of the things we get to when we start thinking about trying to address like social determinants of health is thinking about how to incorporate a health in all policies approach. And I think one of the simplest ways to do that is whenever you're asked, we should weigh in with an opinion, unless it's so completely outside the realm of public health, which obviously is a very broad realm. I think eventually it's not waiting to be asked, but interjecting into public discussions and debates. But at the very least, I think it would be something the board should weigh in on, at least broadly, whether you want to get into that many specifics. As Kathleen mentioned, so the town is over its 40B threshold, which is 10% of the units in the town being considered affordable. Obviously, there are disagreements about how affordable is affordable when you're talking about 100% of the area adjusted median income versus 80, 60, etc. There's some interesting things about density, building near transit, but I don't know if the board wants to weigh in this month or discuss and weigh in between meetings or discuss more at next month, but I wanted to present it for your consideration.
Do we know the timeline on this? And then any board members have questions, you can answer mine last, but any board members have questions or comments on this?
well, the one piece that kind of struck me in here with section N, local preference. And I thought that was interesting because so it says to the maximum extent allowed by law, the town wants local preference observed in tenant and buyer selection, including affordable housing lotteries. Local preference is defined as at least one member of the household currently lives in Needham, at least one member of the household works for the town or for a business, or nonprofit in Needham, or that the household includes a student attending, Needham Public Schools through the METCO program. And then it's a state policies or other requirements may limit or preclude this local preference, which I didn't have time yet to look into that further. But I thought that was interesting because it really does kind of limit people who don't have a Needham connection from moving here. And I don't know what all the implications of that are, but that was something that struck me as I'd like to take a minute to think about that a little bit more. I don't know if anyone else has any thoughts on that. Is that typically done? In suburbs? Is that the way it's often done?
Well, some towns at least used to require that some of their public servants live in the town. And I don't know, and that may be at least part of that statement, but I'm not sure if Needham requires that. I don't know that, or if a percentage, if the police or firefighters or whoever as a public servant lives in town.
So there is not a requirement. The city of Boston, for example, has residency for many public employees, although it's bargained it away for fire and police and EMS, especially after a period of time. State law prohibits communities from requiring teachers to live in that community. There are requirements that sort of on-call emergency personnel, so that's generally all police and fire and in some cases some DPW, have to live within, I don't know the radius, but a certain radius of the community in order to basically respond within a reasonable time if there's an emergency. I think this is fairly common language, but I think Christina makes a good point about if the town is looking to embrace and encourage diversity, whether there's additional language or there's revisions there that could be included that might allow for that.
Yeah, I agree. I mean, I think it, to make the town more diverse, there should not be sort of restrictions to have some sort of Needham connection in advance.
Yeah, I think, I mean.
But I also agree. I need to digest this a little bit further.
Mhm.
I guess my question is, what exactly is the board being asked to do? To support it, or vote for it? What?
So at the very back of so when I forwarded this originally, there was a town manager's email that was included, which is basically said that the select board is going to revisit this and wishes to invite comments from basically everybody.
Okay, that's okay. I see.
So I don't think there was a particular section they were calling out for health review, but again, I think if we're trying to get at social determinants of health and we're thinking about goals, then making efforts to encourage housing as an important component of the overall health of a person in a community is.
Okay, I see that now. Okay, fine.
With that in mind, like just as part of the the policy statement, sort of part 2 under the let me see, the town guidelines, part 2, the policy statement.
Yep.
In terms of housing being one of the most important social determinants of health, we would strongly support not only that at least 10% be eligible to be counted for SHI, but strongly support the last sentence, which says the policy of the select board that additional affordable housing options be considered consistent with the best interests of the town. We would strongly support additional affordable housing options because it supports the best interests of the town in supporting public health.
So just to understand too, is there, so this is any future developments, you have to basically set aside a certain percentage of units to be affordable, right? Just like the previous developers had to do. So then that makes the development bigger, right? And I mean, to make it affordable or, profitable for the developer. I'm just trying to think of are there solutions that in lieu of that, can they put money into a fund that helps redevelop, I don't know, Needham Housing Authority or or other locations? I'm just trying to, I assume, we have no sway on anything like this, but I'm just trying to think of other
City of Boston
solutions.
has a policy where developers can, and I don't know if it's completely, but at least in part, can offer to build, to put into a fund money to build affordable units, which might go further than putting affordable units into a big skyscraper that they're building. I think there's, trade-offs.
Boston has that.
I know housing advocates have different thoughts about that. One is that there's real value in having truly mixed income communities, and that the people that are maybe lower income affordable housing in a larger luxury development essentially benefit from their surroundings. And then there's the other thing of, but a unit in that building is the equivalent of $1 million versus $1 million we could build 4 townhomes in this other part of the community. I know that there's some disagreement and there's trade-offs.
Yeah, I know nothing about this field. I need to learn more. So if there's good recommendations, please offer them up. But, I'm just trying to think of other solutions too. So, I mean, maybe in addition to this, right? I mean, the plan needs, it's, bottomless, I think. So, okay.
So I will, November 16th, I got an answer back to my text. The select board is looking for comments by November 16th and ideally probably before it. The board's next meeting is the 12th. So it seems to me that there should be some work done before the next meeting so that at the next meeting, the board can So if people want to send me questions about this, I will work to get the answers. If each board member wants to think about their thoughts and maybe put them down, I can integrate them into a document and share widely. And then maybe at the next meeting, we'd be prepared to come up with specific points to put into a letter giving feedback.
Okay.
Sure.
Yeah, I think that's great.
Sounds great.
Yeah. Great. Okay, so I think that's everything on the agenda. And
The only other question potentially, and it's certainly easy to do it offline, is whether the board wants to try to establish a date for its December meeting now or wait till the November meeting to establish that.
oh, I think it's probably better if people can do it now. We have a couple of weeks to figure out a December. Since you can't even plan a week out, it's, well, in terms of COVID, it's very hard to know, but yes, any day.
Just a minute. What was the date of the November meeting again? Because I don't have it down.
The 12th.
12th. Oh.
Thursday.
Thursday from 9 to 11.
Mm-hmm. So.
Okay. So then we go to December.
So I don't know, usually we target a Friday or a Thursday. I don't know if Friday the 11th would make sense.
I have a conflict on the 11th.
Okay.
But Thursday the 10th?
I could do the 10th.
Mm-hmm.
Okay, that'll work.
That's fine. Does this time still work? Is this, Christina with
9
Zoom
works.
school and all this? Yeah,
Yes.
whatever.
Yeah.
Okay.
One thing to potentially consider, and I think it certainly Zoom makes things more accessible. The board in the past, when it met more in person on early Friday mornings, always tried to schedule 1 or 2 meetings a year in the evening so that it might work for different people's schedules if they hadn't been able to come previously. So I don't know if the board would want to consider that. It's obviously it's a lot easier to make a meeting now that it's over Zoom and you can hop in from wherever you are. But just something for the board to consider either for December or maybe into 2021.
Yeah, I was thinking of that too. Yeah.
Yeah, I would love
Let's wait till after the
those
beginning.
options.
Yeah.
I can do early morning now, or since
That's
it's
right.
here.
You could do Sunday. Every day is the same. Yeah. Okay, so does anyone want to try for an evening meeting in December or instead of that, the 10th? Or
I don't know if it has to be. I just wanted to make the board aware of
Yeah.
it. Maybe in thinking about the 2021 meetings, the board tries to
Okay.
incorporate that in one of its first 4 meetings, have it at a different time.
Yeah, let's do
Okay.
that after the beginning of the new year.
Okay. All right. So we have the 10th. 10th, is that what we said?
We said Thursday the 10th at 9 to 11. Same
At 9. Okay, great. All right. Terrific. Okay, so I think we're all wrapped up. Do I have a motion to close the meeting?
Motion to close.
Second.
Okay, all those in favor? Kathleen, aye. Steve?
Aye.
Christina?
Aye.
Rob?
Aye.
And Ed?
Aye.
Okay, great. Thanks, everyone.
Thank you.
Okay.
Thank you.
Thanks, everybody.
All right.
Okay.
Good.
Take care. Have a good day.